So Dr. Schneider, can you tell us a little bit about what the Global Health Scholars Track entails?
The Global Health Scholars Track was something that I've been working on for ever since I've been at University of Chicago. So what this does is allows for a structured curriculum, which includes didactic coursework on global health topics. And we try and do a more interdisciplinary approach to global health, so we focus also on policy, ethics, human rights, things of that nature across the university. Students in their first year generally pick a mentor and will select a research project to focus on. We like to see them build a local relationship internationally and then develop that over the years. And so that could be multiple trips to and from the country. At the end of their fourth year, they should have some culmination project or experience that kind of launches them to the next stage. While there is a scholars track component, which usually entails having a scholarly project, some sort of research experience internationally, we encourage all students to have some sort of international experience, because what that does is it gives them exposure to clinical conditions that they may not see here.
So I actually got to travel to Peru this last summer as a part of Remedy, which is a student-run organization supported through the medical school that recovers medical supplies for developing countries. And we were able to spend a couple of weeks there and had the interesting opportunity to see Peruvian healthcare kind of from top to bottom. So we got to see like a referral center, like a teaching hospital in Lima and in Trujillo, two large cities, all the way down to these rural clinics. Needless to say, it was an experience very different from the structure of American healthcare, and I think that was, one of the most important parts of the experience for me was being immersed in that kind of different perspective, a completely different perspective, and not just having to do with having limited resources, but also just having different problems and trying to solve them in creative ways. It was something that I could have never learned about in that kind of depth without actually getting to go.
Most of our students will have some sort of international experience at this point. I mean, it's getting close to 60% of the class.
Just before the start of second year, actually, I had a chance to go to Hyderabad, India. And the main goal of this trip was basically to sort of take us out of the typical learning setting and the learning environment of medical school, put us in a different setting and actually see how medicine's not only practiced but also taught over there. We had a chance to live with a lot of the patients that we would see being treated regularly there. We ate dinners with them and things like that. It was an incredible, very, 100% full immersion experience.
How would an interested student in global health in general or in the Global Health Scholars Track get involved?
So it's actually, it's pretty easy. There's 2 or 3 key faculty that interact with students about global health experiences and research, and we kind of know everybody, so we're able to either have them work with us if it's relevant, or key them in with the right faculty mentor.
I too, when I came to medical school, I knew that I wanted to be involved in international health in some way, shape, or form. I just didn't really know how exactly. And so it was great that Pritzker did have this avenue to at least sort of develop your interest and talk to other people who had similar interests.
There are other opportunities like the Keith Edson Scholarship, which allows for students to also get some funding to do their own project or experience.
What does involvement in global health offer to a student's education that they may not get in other places in medical school?
Well, I'm biased. To get that different perspective that you can then compare to how things are working here in the medical field, I think is invaluable. You may see things there that no one else has seen before amongst your cohort of trainees or other physicians. So for example, we had one patient who kept coming to the ER with some sort of tingling in her arm, and so it wasn't until one of the residents asked her a little more about her background and where she came from that they started to think that maybe this could be leprosy. Okay, so we don't see leprosy here, right? But we see leprosy all the time in India, and we kind of know how to manage it and treat it.
Yeah, that actually reminds me that I was really struck and inspired by one particular physician we met in a rural clinic he was committed to his patients, and he realized, you know, one of the important complications in his region is actually related to childbirth, which is, you know, complications of childbirth, which is something we don't really think about that much, like in this country. He had these little color-coded, like, thumbtacks, essentially, like, that represented all the women that were of childbearing age in his region. And with each one, then he created like a little card, and he followed up with them like on a weekly basis and a monthly basis, and was able to create the system for himself so that he could preventively address these like incredibly complicated problems. And I just remember thinking, like, it was so inspiring to see how like, you know, a committed doctor is a committed doctor in any country, of course.
Exactly.
But just how his commitment had played out in this creative solution, you know, which maybe someone in our country wouldn't even have thought of.
And how have your interactions abroad changed you as an individual and as a medical student?
Getting to actually go and getting to see it, getting to be there and interact with the people, getting to live with a family. I already know that they're like important for me and that they'll shape me as a physician, but I suspect that sort of the extent to which they'll do so, I don't know yet. You know, I think it's going to continue to affect me as I continue my education and later as a physician.
You know, if we benefit the health in other countries, we'll see benefits here as well.
It's hard sometimes when you're in one location all the time, working with one particular patient population, to realize that there's a world out there. There's a whole world out there. And it also reminded me that no matter what happens in the future, there will always be a need for doctors. No matter where you go, no matter what environment you're in, people will always need medical attention. And hopefully we'll be able to be there to provide it for them.